The 2017 County Achievement Award goes to Scott County for its Syringe Exchange and Outreach program. In early 2015, it became apparent to health professionals that something unusual was going on as they were seeing a spike in hepatitis C and HIV cases.
I think in approximately the 3-year period prior to that, we had seen maybe 3 or 4 cases. And then suddenly, in a month's time, we had 30 cases reported.
None of us really knew what to do. We knew exactly what to do. The state came down, they set up the one-stop shop.
What is a one-stop shop? It's where those suffering from drug addiction can exchange their needles, but more importantly, seek services as public health staff build trust among patients. And in Scott County, that meant sending public health staff on the road in search of people to help.
I will never forget the one day we stopped at a house and a girl came out and she's like, "I want needles." And I said, "No problem." So right on the street, we did the needle exchange, gave her needles and talked to her about rehabs and what we need to do and all this stuff. We were talking to her, and I remember as we're sitting there, people came out of that house, and people came out of that house, and people came out of that house, and they all just surrounded the van. They're like, "Well, we want help too."
We needed to do was to focus on that harm reduction and to give people the tools and the education and the resources to, first of all, reduce the harm, and then second of all, we can start to address the treatment issues, the criminal justice issues, and the drug abuse issues.
It's an outreach. It's a way to reach out to individuals who don't normally engage in the medical system. We either judge them, intimidate them, and make them scared. And the needle exchange is a way to reach out to them and meet them on their terms and let them know that there is help.
Another critical reason outreach and education is so important are the costs associated with treatment, some of which are borne at the state level and some at the county level.
The costs can be tremendous. There is grants available, and we've been able to utilize many of them. And that's a big part of it, is finding where you can find the financing.
Is going to create a huge revenue backlog as far as funding for the patients that are HIV positive, and we can keep them from being positive, then we're saving the state, $500,000 per person.
The Syringe Exchange program has brought people together to have a healthy discussion about how do we manage individuals with drug addiction, what's the impact on society, and what do we do as a community.
We've gotten an awful lot of people in recovery, and that's what we're trying to get the word out, that we are now a community of recovery.